Holt International's Child Nutrition Program is designed to standardize child growth screening protocols to ensure that children are growing to their full potential. An important part of this process is anthropometric measurements, which refers to the way that children are measured and includes measurements like height and weight. This video will demonstrate proper procedures for measuring the weight of a child. The routine assessment of a child's growth provides an important guide to a child's health, development, nutritional status, and response to treatment or nutrition interventions. We measure weight to help us assess a child's development. Weight is a fundamental measurement for tracking a child's growth and malnutrition risk. Measurement technique. To measure a child's weight, you will need the following tools: an infant scale or standing scale, a pen, and appropriate growth charts. The tools you will need to measure a child's weight include an infant scale for children under 2 years of age and a standing scale for children older than 2 years of age. It is important to use a quality, accurate scale for this measurement. The type of scale you will use will depend on the age of the child. It is also important for the person measuring the child's weight to consistently use the same correct techniques to ensure accuracy. Before you begin, ensure that one caregiver is assigned to the role of assistant, and the other caregiver is assigned to the role of lead. It is important to sanitize all measurement equipment before the screening of a child, between screenings, and after you have completed all screenings for the day. There are 3 methods to measuring a child. First, for children under 2 years old, use the infant board scale. Ensure the scale has been cleaned and sanitized before measuring children. The scale needs to be set to 0 and measuring in kilograms. Before weighing an infant, caregivers should remove all of the child's clothing, as well as their diaper. If it is not possible or appropriate to remove the diaper, ensure the diaper is fresh and clean. Do not measure a child immediately after a meal. Place the infant in the center of the scale. Ensure that the infant is not touching anything, including the caregivers, when reading the measurement. If the infant is moving and fussing, try to comfort and calm the infant down until they can keep still before reading the measurement. For children under 2 years old that are able to sit up by themselves, you may allow them to do so. If a baby scale is not available, or if the child is too large for a baby scale but is unable to stand by themselves, you may utilize the tare function on a standing scale. To properly use the tare function, the assistant first stands on the scale. The lead will then hit the tare button until the scale reads 0. Then hand the child to the assistant on the scale. Read the child's weight out loud to the nearest tenth of a kilogram, and then immediately record. If a tare function is not available on the scale being used, subtract the weight of the caregiver from the combined weight of the caregiver with the child. This will give you the child's weight. Read the child's weight out loud to the nearest tenth of a kilogram, and then immediately record. For children that are over 2 years old and can stand on their own, the caregiver should instruct the child to stand on the center of the scale. Ensure that they are not touching the wall or a caregiver. Read the child's weight out loud to the nearest tenth of a kilogram, and then immediately record. Remember, do not weigh children immediately after a meal. Infants should be weighed completely naked to ensure accuracy. If you have concerns about a child's warmth, lay a blanket down and repress the button to 0 out the scale. Then you can place the child on the blanket on the scale. Children over the age of 2 should not be measured with their shoes on or heavy clothing. If appropriate, children should be weighed only in their undergarments. Children should be in the center of the scale and remaining still. Say the measurement out loud and immediately record the measurement to the nearest decimal point. Sanitize the infant board scale or standing scale between the children to decrease the spread of disease. Documentation. A single measurement does not reflect the rate of growth. In order to establish a child's growth trends, the child's measurements must be routinely made and plotted on a growth chart. Measurements should be immediately recorded into the nutrition screening system. The nutrition screening system form should be completed within the same day as the child's measurements. In order to complete the nutrition screening system action plan, growth charts must be consistently plotted and interpreted. This measurement must be recorded in the child's record in the nutrition screening system database and must include the date and name of the measurer, and plotted on weight for age, weight for length, weight for height, or BMI growth chart. There are 4 growth charts that use a child's weight. Depending on the age of the child, you may use one or more of these charts. Weight for age reflects the body mass relative to the child's chronological age. Weight for length, or weight for height, indicate if a child is wasted, within normal ranges, or overweight. This can be impacted if a child is stunted. BMI, or body mass index, is directly correlated to the amount of body fat a person has. Each child should have their own set of growth charts that track their overall progress. Refer to these charts when determining the child's overall health status. Watch the growth chart training video to learn more about proper growth chart plotting and chart interpretation. You may also review the Child Nutrition Training Manual or corresponding child nutrition training modules. Tracking children's growth consistently and accurately is one of the best preventative methods for combating malnutrition early in a child's life. This is just one of 5 critical indicators of a child's growth and development. Please review Holt's other child nutrition training videos.